What is the recovery time for the coronavirus disease?
Using available preliminary data, the median time from onset to clinical recovery for mild cases is approximately 2 weeks and is 3 to 6 weeks for patients with severe or critical disease.
Who is most at risk for the coronavirus disease?
People of all ages can be infected by the new coronavirus 2019 nCoV. Older people, and people with pre-existing medical conditions, such as asthma, diabetes, heart disease, appear to be more vulnerable to becoming severely ill with the virus. WHO advises people of all ages to take steps to protect themselves from the virus, for example by following good hand hygiene and good respiratory hygiene.
Is the coronavirus disease the same as SARS?
No. The virus that causes COVID-19 and the one that caused the outbreak of severe acute respiratory syndrome (SARS) in 2003 are related to each other genetically, but the diseases they cause are quite different.
Is the coronavirus disease new?
Coronavirus disease COVID-19 is a new strain that was discovered in 2019 and has not been previously identified in humans.
Is there a vaccine for the coronavirus disease?
When a disease is new, there is no vaccine until one is developed. It can take a number of years for a new vaccine to be developed.
What are the symptoms of the coronavirus disease?
The most common symptoms are fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, and even death. The period within which the symptoms would appear is 2 to 14 days.
Tiredness, the body feels completely tired, without energy. High fever, the body temperature can exceed 37.3 Celsius degrees. Dry cough, constant coughing without expelling any mucus. Difficulty breathing, breathing actually feels more difficult. What to do if you have symptoms?
Step 1. You have symptoms or have been in an infected area. Step 2. Call the designated phone number for your region. Step 3. You will be given a home test over the phone. Step 4. Patiently wait for the results of the test. Step 5. Follow the instructions provided by the doctor.
What should you do if you think you have the coronavirus disease?
If you have fever, cough and difficulty breathing, seek medical care early. Stay home if you feel unwell. If you have a fever, cough and difficulty breathing, seek medical attention and call in advance. Follow the directions of your local health authority.
Can you contract the coronavirus disease by touching a surface?
People could catch COVID-19 by touching contaminated surfaces or objects, and then touching their eyes, nose or mouth.
Can babies get the coronavirus disease?
We know it is possible for people of any age to be infected with the virus, but so far there are relatively few cases of COVID-19 reported among children.
Is headache a symptom of the coronavirus disease?
The virus can cause a range of symptoms, ranging from mild illness to pneumonia. Symptoms of the disease are fever, cough, sore throat and headaches.
Can the coronavirus disease spread through food?
Current evidence on other coronavirus strains shows that while coronaviruses appear to be stable at low and freezing temperatures for a certain period, food hygiene and good food safety practices can prevent their transmission through food.
Is the coronavirus disease more severe than the flu?
COVID-19 causes more severe disease than seasonal influenza. While many people globally have built up immunity to seasonal flu strains, COVID-19 is a new virus to which no one has immunity. That means more people are susceptible to infection, and some will suffer severe disease. Globally, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected.
Are masks effective against the coronavirus disease?
If you are healthy, you only need to wear a mask if you are taking care of a person with suspected 2019 nCoV infection. Wear a mask if you are coughing or sneezing. Masks are effective only when used in combination with frequent hand cleaning with alcohol-based hand rub or soap and water. If you wear a mask, then you must know how to use it and dispose of it properly.
How to use a mask?
Before wearing a mask, wash your hands with an alcohol-based disinfectant or with soap and water. Cover your mouth and nose with the mask and make sure the mask is firmly pressed against your face. Do not touch the mask while you are wearing it. If you do, wash your hands with an alcohol-based disinfectant or with soap and water afterward. Replace the mask as soon as it gets wet and do not reuse disposable masks. Remove the mask from behind, do not touch its front side, throw it away in a closed container and then wash your hands with an alcohol-based disinfectant or with soap and water.
What is a mass gathering?
An event counts as a mass gatherings if the number of people it brings together is so large that it has the potential to strain the planning and response resources of the health system in the community where it takes place.
Protecting yourself and preventing the spread of the disease.
Wash your hands with an alcohol-based sanitizer or with soap and water. Keep a distance of at least 1 meter between yourself and anyone who coughs or sneezes. Try your best not to touch your eyes, your nose and your mouth. Cover your mouth and your nose with your bent elbow or a tissue when coughing. Seek medical attention if you have difficulty breathing and a high fever. Follow the directions of your national or local health authorities.